Thank you for joining us for this webinar. I know there are parents, students, and teachers, members of the staff with us. I really appreciate your taking the time to join this important webinar. First of all, I want to thank Ilaria Costa, Director of IACE, for coordinating it. And of course, our wonderful guest, Dr. Silvana Riggio, who has been with us. She was with us in June to do another webinar on COVID. She's our scientific advisor and has procured us a number of consultants, medical consultants, for a lot of the topics that La Scuola is interested in sharing with parents and, of course, students and faculty. The decision to open in person from the very start of the school year was not really an easy one to make. The board of trustees and members of the faculty were asked a lot of questions, and we thought that for the welfare of our students, for their emotional well-being, and given the fact that the infection rate right now is very low, we wanted to bring everyone together. Obviously, with all the precautions, with the distancing, with disinfecting every day, with wearing masks, with hand washing, all of the precautions that are possible to bring our students together. We do not know what the fall is going to bring us. But we would start meeting with students in person and see each other. It's good for them. School as an important component, and that is socialization. So our students missed it a great deal. And frankly, I miss them. I miss seeing everyone. So Dr. Riggio is going to talk to us from our medical point of view. She sees a lot of people. She works in a hospital. She is current on all the developments on COVID. She's also a mental health expert, and she could see the benefits of having students come together. One of the main things that I'm learning is to make sure that there is ventilation, sufficient fresh air coming in. We are fortunate to have Central Park near us. As you all know, we will be at 96 altogether. We have small class sizes, a small number of students, so we can come together and be in a place that permits us to put all of these protocols in place. Some of you may think that we are probably going overboard. We are exaggerating, but there is no exaggeration when it comes to health and safety. It's better to do a little bit more, perhaps, than to do a little bit less. We will bring on board a nurse. She will start working with us on September 1st. And so we will have someone who has more knowledge in terms of dealing with emergency issues. We hope never to have one. So, and Dr. Riggio is with us. I contact her numerous times when I have questions, and she's always so gracious and so helpful. She loves La Scuola and is always ready to help us. So, Dr. Riggio, thank you for joining us. And I know parents have a lot of questions. We will be able to respond to some of them today, perhaps. Ilaria will then give us groups of questions, topics that parents and other members who are watching this webinar will be asking. And then if there is a need to send the participants a follow-up answers, we may not have all the answers that may be to the questions that may be asked today. So the communication that will continue, I think, will be essential. So again, thanks to Ilaria, and big thanks to Dr. Riggio, and to those who are participating. Thank you.
And thank you, Dr. Palandra, for inviting me again to share the message, and I hope it's a positive one. And it's always a pleasure to work with you, Dr. Palandra. And we share the passion for the Italian school without a question. And that is what has made this a very healthy and fun relationship. And in fact, healthy and fun is what we need to make it also for the children, for our children. And I start by saying, you said we don't know what the fall is going to bring. And yes, it's true, we continue to live a climate of insecurity, fear of the unknown, vulnerability. That is a prevailing sentiment for different reasons, and especially as it relates to our family and children. But I want to emphasize during this time of insecurity, that is important to focus and to focus on all the positive things that we can do to stay safe. And there are a lot. And that education is the most important way to keep ourselves and our children safe. And I'll start with one positive message of today. That when I'm looking at the data, there's only 183 new positive cases and 15 new hospitalization in the entire city. Okay, and that is a great message, is a positive message. Nonetheless, we do have a virus that is part of our community, is there, and the key is offer the education, the reality for all of us and for our children, and to make sure that we give the reality in a fun and healthy and reassuring way. Children don't understand all the detail, but understand the perception of the truth. So we have to give them the truth, but also say, this is what the strategies that we can put in place to keep positive and to give healthy solution and making them part of the solution. Okay, we are not imposing rule and regulation onto them. We're going to try to make them part of the solution. And I know that Dr. Palandra has already done a lot to make that happen, because they are. For just like we, each one of us has to be responsible, we need to teach them how to be responsible. And this is a great opportunity, by the way, to teach responsibility to our children, to teach them how to stay safe and how to help the family, the parents, the grandparents to stay safe, because their behavior is impacting just like our behavior in the entire family, in the community. In this case, the community is the Italian school and themselves. Ilaria, can I block you because it just comes on my screen? It's distracting to me, or no? Can I block your image because it comes on my screen and it's distracting to me, if possible? Otherwise, no big deal. So that I only have my image. Okay, thank you. So again, giving the reality that there is a virus out there that can impact our health at all levels, both physical and also mental. In fact, and I know that again, Dr. Palandra has given a lot of education about what to watch, even before to get to school. Check for the fever, check for the symptom, the physical symptom. Do they have a cough? Do you have chest pressure? Can they have problem breathing? Is there fatigue? And main muscle aches? Do you have nausea? Do you have diarrhea? So that before they get out of the house, there is a nice, an important check. The same check is going to be when they get to school. But as parents, I want to warn you, just like to pay attention to your own feelings, to the one of the children. Like Dr. Palandra said, I am a psychiatrist. I am a mental health provider. We provide education for our own staff and debriefing on a regular basis, once a week at least. And you do the same with your kids. Keep them in check and pay attention Do they change any habits in eating, in sleeping? Are they more irritable? Are they more withdrawn? And so if you see all the symptoms in addition to the physical symptoms that we have talked about, bring it up, pay attention. Can they be becoming depressed? Can they be anxious? And do you need to talk to your doctor, or if need be, to a mental health provider? Okay, your doctor can give you advice. You know, if you ever need to contact me, Dr. Palandra has my contact. But more important, talk to your kids and say, hey, you know, if any one of us gets irritable, withdrawn, we need to talk about it. We need to understand it. This is a very difficult time for everyone, adults and children. And they went to a period of isolation just like all of us. But we as older people, we have more tools to resort to that help us through this time. They have the parents and they have their friends, which during this time they have not been able to see. Okay, but they are now, and this is a good time. And so as they get to school, and as there will be a different way of sorry for that, a different way of being at school. There is social distancing. They're going to have, as they go to school, as they enter, there's going to be a check of fever, check of symptoms. Then they're going to have an enzyme. They're going to be requested to wash their hands. And by the way, you know, wash in every exam in medical school, they will ask for all the years since I started medical school, what is the most common way of getting an infection? Even if it's a simple cold or a flu, is by a hand contact or just touching the doors that other people have touched, okay? So this is a good opportunity to learn a very simple measure that will help them throughout life and give it to them in a positive way. This is, you know, a handshake and touching of surfaces, especially handled in the bathroom, as being the way to transmit flu, colds, every different, all the myriads of virus that we have during the flu season, okay? So they're going to get to school, there's a different routine. But tell them that this is a healthy routine. It's a healthy routine because now we have this virus, which is called COVID, which can affect all of us. But this is the way that we take care to protect ourselves against this virus. Because there is a way. Distancing, mask, make sure that they learn how to put the mask. I'll show you, you know, whatever mask they use. Even if they use a surgical mask, you know, if they have glasses, that if you breathe heavily, that there is no fogging of the glasses, okay? If I don't have the mask in the right way, you don't see it, but I do, they fogged up a little bit. So whatever mask they are, there is a seal on the nose and on the under the chin, and there is not this kind of mask holding because the virus is in the narthex. That's the place. That's why we do a nasopharyngeal swab. That is the highest percentage of where the highest the virus hides, and in children, that's where the highest viral load is, just like in adults. Okay. So simple measure, maybe find an activity, strategy to make it fun, either to make the mask together at home or finding masks with, my godchildren love the little mask that I gave them with little animals or little different characters, whatever we can do to make it safe, providing the information, providing the checklist, and help them understand that everybody's going through a difficult time, including the parents. It's very hard. Sometimes the parents hide and they don't want to show that they're worried, but for the children, it's helpful to know We're both all worry, but we're going to find positive solution. And the first one is taking care of ourselves. Washing the hands, washing them well. You know, I see even in the hospitals, we teach staff to wash their hands. Somebody does like that, done. Washing the hands, 20 seconds. The time, I'm sure you heard the talk about the singing of the song, Happy Birthday to You. And that's 20 seconds. Like this, under the finger, and then and a lot of soap. I told you about making sure that the mask is in place, because that's how we protect ourselves, and then we keep the distance. And if you learn how to do that, either if you're outside or inside, it becomes part of the program in our brain until we don't even have to think about it anymore. It becomes as an automatic response. Okay, and it basically is teamwork. Teach them it is teamwork. They're keeping themselves safe. They keep the family safe when they come home. They keep the other children in the community safe. This is teamwork. Has been shown to work very well. We need to protect each other. It's not such it's a wonderful message to learn early on in life, you know. So important step. Provide a healthy environment at home and for you parents in school, which Dr. Palandra has done. I understand, again, there's distancing of the desk. I was thinking of the bunkie of the desk. There's open window. There is purifier. There is hand sanitizer anywhere. I understand she has a nurse to receive the kids. There is an isolation room that, God forbid, any one of the kids will have a symptom. In fact, tell them, don't be shy. If you have a symptom, let us know, let your teacher know, so they can immediately put them in the room where the nurse is, calling the parents, and then the parents can call the doctor and you go from there. But promote healthy environment, promote healthy behavior, promote a sense of responsibility and teamwork. It's healthy. So basically what that does, puts them in charge, puts them somehow in control in a situation where not, or at least gives them a sense of control in a situation where all of us have lost control. And we see it even in the adults. You know, when we have lost control, some people find the control by cleaning the house or cooking, like me, some others by getting involved in different activities, in learning a new skill, learning how to play music, whatever it is that makes the parents and the children feeling in control. And then education, sharing the reality, finding the positive message. And that's my message over and over today. A way, give the education about the spread of the disease, way to avoid it, increase awareness on possible symptoms, both physical and I keep saying emotional. We do have out there a pandemic, which is an emotional pandemic. We need all to be aware, talk to your doctor, talk to yourself, really understanding where you are without hiding. There is plenty of help out there. The city, I have to say, has put a lot of hotlines on mental health outlines. There is a lot of testing sites all around the city. And that's how we keep ourselves safe. And now, any question? I hope I gave a positive message, which is the message we all need to hear and to follow.
Dr. Riggio, you have been very helpful and indicated to us a testing center for COVID that would provide results in a day practically.
Yeah, there's a testing center in the city, and I don't want, you know, obviously I'm part of Mount Sinai, and was I recommended also because it's close to the school, but I don't have any interest in the testing. It's done by the Express Care by Sinai. And the site, again, there are many testing centers all over the city. Some take 3 to 5 days, some things a week. We take 7 to 10 hours, okay? So the place is on Fifth Avenue. You can enter on Fifth Avenue at the entrance of 101 Street, and all over the place is written Express Care. So you go there, it's open from 8:30 in the morning to 8:30 at night during weekdays. I did it the other day, I do it every week. And it's Saturday to Sunday is 9 to 4. For whoever who didn't have a test done yet in this month, it's like a little little pencil sled, a little not as thick, but they put this little, oh my God, I cannot think of the word. I cannot think of the word, but it's oh, come una piccola penna, ma non così spessa. I don't know how to say it. It doesn't come the word in English, sorry. But they put it in the nasopharyngeal, you tilt your head. It is very uncomfortable. And they twist it for 15 seconds. So get ready to take a deep breath and prepare your kids, because it's very uncomfortable. It's not painful, but it's uncomfortable. It's that ticking, you know, and my face, I think, expresses it all. But that's all. And then 10 hours. Oh, when you go, if you go as Sinai, ask them to get, when you sign in, that you would like a computer access. So that in 10 hours, they will get the results on your computer. You can see it on the computer, okay? In general, what they do, they charge the copay of your insurance, and then it's my insurance and your insurance, my understanding, then your insurance will pay the rest. And depends. For some people, my insurance pays $15. For the other, can be 30, up to 50 for some people. So check it out before, and so that you can decide what to do. But in this case, it's reliable. They've done thousands of tests. It is quick. You don't have to. Also, because you want to do it before, you know, for the security back of the team of the community, you want to do it 2 days or 3 days max before you go back. The children go back to school. So so you know the people have been are safe. I would do it like, if they go Monday, I would do it Saturday, you know, Saturday in the afternoon, and everybody, and then keep yourself safe and not risk to go places or meet people who are positive for COVID, you know, and keep in isolation until you go to school. Then we know that everybody starts school safe, and then from then on, we keep ourselves safe every day by keeping ourselves in check, and also not forgetting to have fun. You know, and again, the Teresa Paladra has made all the prerequisites for to be fun, like access to the park, access to different gym, distancing, fresh air, and all that she could think. Education, which is done, she will continue to do, and sanitizers all over the place. And if children forget the mask, I think she has the availability of having a mask. Okay.
Dr. Riggio, one additional question about the test. Obviously, what we want to know is if there is an infection in any of us, whether it's the children, whether it's adults. When a person goes to the center for testing, we would say that we really want clearance to be able to go back to.
Yeah, sure. Yeah, go ahead. Sorry.
I did send a message to parents, which really was not, since I am not in the medical profession, I had gathered some information. I want something very simple for our children. I just want to know if there is an infection there, so that
they won't give you a specific note for clearance, but it will tell you if they're negative or positive. So in 10 hours, the parents can get the certificate, and then they can provide the school with the certificate.
And that's really what the school needs. So if I am...
the computer, I'll show you, I just did it the other day, I'll show you 1 second, I'll show you. And I'm doing it, you know, it's a matter of responsibility. I'm going to the wedding of one of our goddaughters, and everybody, there are only 20 people, but whoever is going will be required on Friday to do the test and then to stay isolated until the test. I just, what is it? Okay, but the bottom line is they send it to you on the computer, and I send it to me on my cell. Here it is, and it comes something like this with your name, your name, and if it's negative or positive, and then you can provide that to the school.
Okay, so I'm going to send a follow-up email to parents clarifying what the test should be about and the purpose for it. There are some people who might have had COVID. Would results of the serology test be something we would want, or I know that people test frequently too.
For antibodies, the issue with, I'm not an infectious disease person, okay? So my understanding for our infectious disease people, the important is to know that everybody's negative when they start. The serology, unfortunately, gives the false sense of security because we don't know what the viral load need to this day. Maybe we will as things change day by day. In fact, I will want to make a point on that in 2 minutes. But the antibody, even if you have it, we don't know what the viral load is and for how long they will be positive. Okay, so it could be that you have antibodies today, but then tomorrow you don't anymore. So that's not important. What important is that children don't have symptoms, and as you come in just for a measure, you'll have people, everybody starts with a very good positive mind of saying everybody who's starting is negative. And then from there on, keep each other in check, that as soon as you have a symptom, you know, they'll tell the teacher. If they're in school, the parents will talk to the physician and being in contact with their pediatrician to know, do they need to worry? Do they know not to worry? Do they need to be retested or not? The CDC recommendations are crazy because they're changing every day. In fact, up to today, the way the recommendation went, and we'll read it, was that it was if people had symptoms, they had to stay home 10 days from the first symptoms, or 24 hours where they had no fever without aspirin or Tylenol or any other symptoms. And the asymptomatic people who were in contact with a COVID positive person, like a child with a grandparent or a parent who was COVID positive, they had to stay 14 days in isolation. Today, the CDC came out with a totally different recommendation that made everybody totally crazy. And I think they're probably going to change it because there's been a lot of backlash for this recommendation, that if the person is asymptomatic but has been exposed to somebody who is COVID positive, they didn't need to be tested, or they didn't need, to be in isolation or tested, which it makes no sense. So if you see the recommendation of today and you're going to shake your head, know that all of us, the scientific community, is all shaking our head, and tomorrow they might come up with a different recommendation.
Thank you.
So that's because up to now it's been that even if you were asymptomatic but in contact with a COVID positive, you need to let your team know, in this case the school know, and be in isolation. So in that case, my recommendation until the CDC recommendation will change, because after all the backlash they will, that you'll talk to your doctor and discuss that with your doctor.
I'm glad you mentioned that, Dr. Riggio, because we had to submit plans to the health department, and to the State Education Department with the understanding that changes will occur and we will modify our plans accordingly.
Exactly. So stay tuned for this recommendation. Any questions?
Yes, many. We have many questions.
Oh.
Yes. Basically, one question: Do we need to book our test session at Mount Sinai, or is it a walk-in?
It's a walk-in.
Walk-in.
You go
Okay.
101 Fifth Avenue. Look for the big sign that says Access Care. It's not part of the emergency department. It's part of the hospital. And you sign in and you have the test done. And request the computer access, please.
Okay. Another question regarding the testing site.
Express Care? Yes, Express Care.
Okay. Another question regarding the testing side. If we are supposed to swap 3 days maximum before the first day of school, is the testing center open on Saturday, Sunday, and Monday of Labor Day weekend?
I did say Express Care at Sinai. And again, there are other testing centers in the city, okay? I just mentioned that to Dr. Palanda because the issue was how for some places it takes 3 to 7 days or 3 to 5 days, and this takes 10 hours. So it is open 8:30 in the morning to 8:30 at night on weekdays, and is open from 9 to 4 on the weekend. So you can do it Saturday, and then make sure that you don't have the children don't have any contact with anybody who's COVID positive, 2-3 days, because that's the incubation goes from 2-3 days to 15 days, okay? So if we want to make sure that everybody who starts school is negative and safe, you know, Saturday morning would be a good time, or Friday, and make sure you have no contact with people who are COVID positive, and then you start all healthy. And then from then on, you just keep social distancing, the mask position in the right place, washing your hands.
Okay. One clarification.
I need to turn this off. Yeah, go ahead.
Okay. Yeah, you talk extensively about this, but just to make sure, because I see the chat is going crazy about this. So they only need the COVID-19 swab, not the antibody test. Is that correct?
No. The antibody test doesn't tell us, unfortunately, so far with the data that we have, and it tells us that we had an infection, not that we have it now. And there were some antibodies, but doesn't tell, unfortunately, right now, we don't have the data or what viral load needs to be present in those antibodies and for how long we're going to be positive. So you might do it today. So it tells you, okay, I had infections sometimes in the past. Maybe I know when, maybe I don't because I was asymptomatic, but I don't know if I had antibodies for the last month or 2 months and now tomorrow it won't be positive anyway. Or if it protects me in any way, right? We don't know. We'd like to know. Listen, we are all, like I said in the beginning of this talk, dealing with the fear of the unknown. We all want clear answer, and the press and the CDC itself didn't help us in many ways, but the one thing that did help us, the virus gets transmitted to the droplets, and when the droplets fall to the hands or touching the surface. So the major thing is stay distant, covering the mouth, and washing our hands and not touch our mouth and our eyes. So if we can teach ourselves and the children that, as I said, we help them not only for COVID, but for all the influenza time that they're going to have to endure the rest of their lives, because that's the way these respiratory viruses get spread.
Thank you. Another question regarding masks. Do the kids need to keep the mask all day long? Also pre-K kids? Yeah.
Like the adults, yeah. I have a 3-year-old goddaughter who's going to kindergarten and keeps the mask all the time, except when they eat.
We included in our plan.
If they're at home And if everybody in the household is negative, no. If they are outside, you know, with nobody around, you keep the social distancing, you know, and they don't. But in school with their other kids, yes.
We will have mask breaks for children, but it would be supervised. Again, when they eat, there might be a few other instances where there are breaks, but it will be very well supervised.
Distance, right? Social distance.
Yes, yes.
Maybe they'll all eat at the park.
Maybe they'll eat in the park. And yes, it's understandable for young children especially, but they want them to be safe.
It's tough, but make it fun. Make it fun. Again, make them fun mask that they can maybe change every day, or they can add a color to their dress. I lived there, I told you, with my little goddaughter who was 3 years old, and every day she'd go, what am I going to wear today? Which one do I wear? She goes, Mom, what dress do I have? And they have different color, you know, try to make it as fun as possible. If the child has a crisis, understand it and figure out a way to give him a break away from everybody else when he's not talking or she's not talking. We have to work with that.
Thank you. There are some
questions about teachers.
Yes, the questions for teachers we are going to answer separately, but I think there were some other questions from parents.
I'm looking. Will the children also wear a mask when they are outside? I would really support that, as on playgrounds there will be other children we don't know.
It depends. If they play with each other and they're close, yes. If they can keep at least a 6 feet distance, they can be free. We have a 6 feet distance rule. If they don't scream at each other, yell at each other, and go close, great. If there is, we know that they're going to get close to each other, then they have to have a mask. Just like people who run, you know, and they should have a mask as they go by people, because also with the yelling and the screaming will project, and if there is wind, we project the virus further away. So it depends where we are and what they're doing. If they're just walking outside and just talking normally, as long as they're distant 6 feet, it's okay. If they're running and screaming, you should have a mask. And they're not 6 feet distant, you should have a mask, like everybody else.
Ultimately, we want to.
The virus spreads, guys. The virus spreads through the droplets, and from touching. The droplets can go up to 6 feet distance, and if you're running or screaming, even a little bit more. So with that in mind, keep safe and keep your children safe.
Another question regarding masks. Can kids play together and share toys?
Say that again.
Can kids play together and share toys?
As long as they wash their hands. As long as after they play, they wash their hands and not touching the mouth. Right?
We are also selecting those toys that are allowed to be in the classroom that have been disinfected early on. And as you say, every time they touch those toys, they wash their hands and we disinfect them.
Exactly.
We disinfect the toys.
Listen, it becomes a way of life. Understanding that is true, you know, years ago in the 1800s, that's how we found out that infection spreads through not washing their hands. One physician noticed that there was one hospital where there were two surgical operating units where women were giving birth. And the women that gave birth in one unit will have more infection than the other one. And this one physician was actually hospitalized in a psych institute, saying that he was crazy, noticed that the room where this other doctor were going from one operating room to the other without washing their hands was where there were more infection. And he was the first one in the 1800s that proposed the idea that not washing their hands was a way that infection was spread. And I told you, in every exam in medical school, that's what the question is. How do you keep a virus spread from not happening? By washing your hands. So if they play, as soon as they start playing, they wash their hands and before they ever touch their mouth or their eyes.
Dr. Riggio?
But you know what, the more we say, the more it becomes automatic, like everything else that we learn in life.
There is a question about if we have a case in our plan. We wrote that if there is a case in a classroom and we can isolate the number of people who were there, we close that classroom, not the entire school.
That is also not my expertise, and that plan changes every day. But we live in a city that we have more tracer than everybody else in the country right now. So there are clear guidance every day that one would have to call the health department and find out, at that specific day, because that also varies on how many cases are out there, how the mortality rate is at that point. So that you would need to call the health department or your own doctor who can call the health department at that time to decide.
Thank you.
There is another one. What about transmission through the eyes? The transmission of the virus?
It's been shown that if you touch your eyes with your finger while infected, it can happen. And that's why in the hospital, when we get in the hospital and we see patient, I put my I-95, is different than the surgical one. And we have a special pair of glasses. But it's by touch. Or if somebody should cough right in your eyes. We don't know, there are not great studies on this. Okay, everything is if, but enough by making the recommendation by the World Health Organization and the CDC, and enough that every physician is given special eyeglasses to protect ourselves from the virus. And you know what the good thing is? That even in hospital where we deal with people who are COVID positive, especially between March and June, in May, it's been very, very tough. The percentage of people infected is not that high, okay? But nonetheless, we need to keep ourselves safe because the kids come home to parents, grandparents, to teachers were there, and some of them are 60 and more. So this is the time to teach responsibility, education, training, and then until the training becomes so automatic, like when you cross the street, right? Teach the children, look left, look right, look at the traffic, at the semaphore, the traffic light before you cross the street. And here you're teaching a different set of skills that they will have for the rest of their lives.
Another question about the masks. Are all kinds of masks fine?
No, there are certain materials that are better than others. The surgical, it depends. So the surgical mask, which are these, the idea of a surgical mask or the mask that you make at home is that you contain the virus within the mask so you don't spread it, okay? So you have, and even the made home mask, there are certain material that are better than others. You would have to look on the internet, I don't know. The CDC has a recommendation. And then we have this, which is the N95, which protects the person. I use this in the hospital because it protects me from the other person. So not only do I protect the other, so if I protect the other and the other one protects me, we are all protected. And so that's why we have to teach children not to put the mask here, not to put it right there, but to protect, because if we do that for the other one does that for us. And if we are immunocompromised, if there is somebody of the parents, the grandparents, there is immunocompromised or the child for some reason, then the N95 is the best mask to have because it protects you. Was I clear with that?
Yeah, I don't see any other questions, so
Okay.
I believe.
And people can always call me, send me messages and ask questions. Go through that Teresa Palandra. She'll put me in contact. And look at the CDC recommendation every day. So you're going to go crazy because they change every day. But fundamentally, they'll give the major issue that we need to follow every day.
If we do not have any other questions, I want to take this opportunity again to thank Dr. Riggio for our kind presence. And we will follow up with some of the questions that we could not answer today. There would be a clarification memo from me to the parents and the teachers. And I thanks again for being always present. Yes, please.
I want to say one more thing. And I say, you know, out of my heart, the reason why I've been so involved with the school is because of you, Dr. Teresa Palandra.
Thank you.
Your passion, your determination, your love for the kids has really impressed me and my own husband, who's also a physician at Sinai. And that is the reason we love the school, we love the children, we're very committed to the Italian language. But you has been the force behind all of this, sincerely. It's amazing. You're amazing.
Thank you. Thank you. La Scuola has a great community. It's a great community of children, parents, and teachers, and it's a pleasure really to be with all of us.
Love the kids to have you, and the parents.
And for me to have those beautiful children.
Yeah, so make it fun. Ask every day. I'm going to do that myself, actually.
Thank you again, and thank you, Ilaria. I thank the parents and the students and the teachers who are and the staff who are there.
Positive, positive. There's a lot that we know. Okay.
Positive. Thanks a lot.
Bye.
Bye.